But CBC News dug through government reports, finding those annual inspections have all but disappeared for more than a year.
Right now in Canada, long-term care homes are being devastated by COVID-19. In fact, as Global News reports here, nearly half of Canada's COVID-19 deaths are linked to long-term care facilities. So the ratio fluctuates from province to province, but care homes are implicated in about half of the 760 deaths across the country. So clearly long-term care homes or nursing homes are a major part of the impact of this virus. Now, when it comes to the province of Ontario, the Doug Ford government and their cuts to long-term care have definitely worked to exacerbate and cause these facilities to be ill-prepared for this crisis. So first, I want to show you this incredible segment from CBC. This is an investigative piece from David Common. And watch what his reporting found in terms of what the Doug Ford government did when it came to long-term care facilities.
With the death toll mounting in Ontario's care homes, a key question is, were they prepared? Surprise and detailed inspections, like this one previously recorded by our hidden cameras, exist to ensure homes are running safely. But CBC News dug through government reports, finding those annual inspections have all but disappeared for more than a year. Pinecrest, where at least 29 had died by this morning, last faced a resident quality inspection in June of 2018. Eatonville, with at least 27 dead, last checked in September 2017. Seven Oaks, 22 dead, June 2018. Anson Place, 19 dead, June 2017. It's a long list and reveals the Ford government has quietly stopped these detailed checks.
It's incredibly frustrating to hear this. There ought to be inspections of long-term care homes, just as there are of schools and of daycares.
But that, she claims, is not what the largely for-profit companies running most Ontario homes want.
They have lobbied routinely for deregulation of long-term care homes, a reduction in the number of standards, a reduction in the unannounced inspections.
And they have political connections. The chair of Chartwell, one of the largest companies, is Mike Harris, former Ontario Premier, who also cut the inspections before they were later reinstated.
We will overturn every rock, every boulder, if that's what it takes to protect their most vulnerable.
The Ontario government says every home is inspected at least once a year, but after complaints, critical incidents, and reports of serious harm. Critics point out the home knows the inspectors are coming, and the inspection is less detailed.
That's very upsetting.
For those with parents in care, it's yet another concern.
I think that's something that everybody should be aware of, because it is very scary.
Her mother lives here after years of facing yearly quality inspections. The last was 18 months ago. David Common, CBC News, Toronto.
So just a fantastic piece there from David Common of CBC. Now, it's clear that once again, in another example of Doug Ford cuts, these cuts have only worked to intensify already existing issues. So in this case, when you have a pandemic like this, before this pandemic, cuts like this were a major issue. Under a pandemic, it exacerbates any existing issues that exist in the system. And this is what the Doug Ford government has done again and again and again. They've been all about cuts. Now look what's happening. So just to back up some of the information that was in that piece, this is an article from January 4th, 2019. Long-term care homes want end to mandatory inspections. Just going to read a little bit of this here. Ontario's long-term care homes are pressing the Ontario government to get rid of mandatory annual inspections as part of its focus on cutting red tape. Before I even read the second paragraph, when an industry is calling for you to inspect them less, that should be the signal to inspect them more. Clearly here, they are trying to get away with the fact that they want to cut corners in these facilities and that these inspections are preventing them from doing that. Groups that represent the province's long-term care homes have long asked for an end to annual inspections for all long-term care homes and reducing regulations that they say place an undue burden on an already stressed sector. The head of the the head of one of two major organizations, says she is optimistic the province is listening to those concerns. Well, it appears they were, despite the fact that in this article, it says here, but Haley Chazane, spokesperson for Health Minister Kristen Elliott, part of the Ford government, said the province does not have any plans to reduce inspections in long-term care homes. Oh, really? Well, clearly they did. Now, to give you just a few more examples here of these cuts, or at least attempted cuts in some cases, here's from rankandfile.ca. This is from just a couple months ago, right before the pandemic really hit. February 22nd, 2020. Ford invokes wage cap law for long-term care workers. So the people that are on the front lines, putting their lives at risk, keeping the most vulnerable people in the province safe, Doug Ford worked to cap their wages. Now, this is in terms of public workers. So we have a mixed long-term care system here where there's public and private. So because Doug Ford was capping all public wages, that included these long-term care workers. And because this is a public-private system, it also meant that a lot of these workers were then more attracted, of course, to higher paying jobs in the private system instead of working in the public system. And clearly now, these people deserve a pay raise, a massive pay raise, for putting, again, their lives on the line, keeping people safe during this pandemic. More here. This is September 5th. I can barely read this. September 5th, 2019. Premier Doug Ford's long-term care cuts are harming Ontario seniors. These were proposed cuts largely to people working in these facilities and, again, going towards whether it's less inspections or less care of the actual people in these facilities. But then, a couple weeks later, Doug Ford conservatives backed down on long-term care cuts after public outcry. So there were more cuts that were going to happen, that were going to be imposed on long-term care facilities. And this is in addition to the existing cuts when it comes to the inspections. So thankfully, there was public outcry, and you're seeing here NDP leader Andrea Horwath fighting against those cuts. So thankfully, those cuts didn't go through, or else this issue right now in long-term care facilities could have been much worse. One more thing here. The government of Canada is now proposing new guidelines when it comes to long-term care facilities. I'm not going to read through all of this, but I will just show you this important piece here. So there's restricting visitors, screenings for all staff, making sure staff have PPE to deal with to be able to protect themselves during all of this, and also routine cleaning, but identifying staff who work in more than one location and making efforts to prevent this where possible. So this is a step right now that is important in terms of ensuring that the staff at these locations aren't spreading the virus. So many people that work in long-term care facilities work in multiple locations. So now they are being told to just stay to one location to not potentially spread the virus around. So there is some work going on here behind the scenes in terms of the government and trying to address these issues. But it shows you the importance of having somebody in power in government that actually understands the impact of their actions, understands the impact of cuts like this. So while right now Doug Ford is getting a lot of praise for essentially sitting back and letting the experts do their work, understand that the work also that should be focused on is what was done beforehand, before all of this. You can't just ignore what happened over the past 2 years with Doug Ford. You have to also look at what he has done so far that maybe has led to this issue being a bigger problem than it would have been otherwise.